So we're now going to talk about IV therapy and fluids and tubing and IV pumps. And so what we're going to do is look down at the table, and I'm going to show you some different equipment that you might see and use when you're actually having IV therapy. Certainly you're going to verify your doctor's order for any IV fluids that are ordered. You need to make sure the purpose of them, and then you need to know the type of the fluid and then the rate of infusion. So if you'll look down at the table with me, we're actually going to look at some of the equipment you might see and use. So as you look at the table, this is some of the equipment that you may use for the IV therapy. First thing we're going to look at is the IV fluids. And so if you come over and you look at this, you'll notice that your IV fluid should come in a bag or some type of packaging of some sort. If you ever come in and the bag is out of the packaging, you should never use a bag that is not in packaging that is secure. One of the reasons is because somebody could have come through and put some additives in the bag and then didn't label it, and you could end up giving your patient the wrong additives, the wrong medication. So always make sure that you start off with fresh fluids that are in packaging that is clean, dry, and intact. As you look at it, you need to inspect the packaging as we see it. Clean, dry, and intact. There's no leakage, no openings. You also want to make sure that what is in the packaging is what it's supposed to be. So for this one, you'll see 0.9% sodium chloride, which is normal saline. You also need to make sure that you have the appropriate amount. This is a 500 milliliter bag. Most of your facilities have 500 milliliters, 1,000 milliliters. You may see some 250s, 50s, something like that. Consider what the rate that the fluid is going to be going at. If your IV fluid is only going at what we call keep vein open, which most facilities usually run at 30 milliliters an hour, some agencies it might be 10 milliliters an hour, you need to make sure you check your policy at your hospital to be sure. But if you're only running it at 30 milliliters an hour, you probably wouldn't want to grab a whole 1,000 milliliter bag because it would be wasteful. Most of the time these bags are only allowed to hang for a 24-hour period. And if you're only running it at 30 an hour, you need to calculate how much that would be if it's in a 24-hour period, and a 500 milliliter bag would probably get you through that. You also need to go through and make sure that you're within the expiration date, and like I said, that this is clean, dry, and intact. I do have another bag here, but please remember that you can have different fluids besides just the normal saline. You can have lactated ringers, you can have 1/2 normal saline, which would read 0.45% sodium chloride. You can also have dextrose with water. There's lots of other fluids, and when we go over fluid and electrolyte in class, you will have covered this type of content. Some of the other equipment you may have, you'll have the IV tubing, because certainly you have to have the tubing to spike the bag so that you can get it down to the patient. Whenever you look at the tubing, you need to make sure, again, it's clean, dry, and intact. It is within the expiration date. You also need to look and confirm what your drops per milliliter is. And whenever we go over this in class with fluid and electrolyte, we'll talk about this. You typically will have IV pumps that are administering the fluids, but there is drop per minute math to where you go through and you calculate, you actually stand there and count how many drops fall in a minute, and then you do your math calculation, so you could actually convert it over to milliliters per hour. This is very important, so you always want to make sure and go and confirm this as well. You also need to make sure that the set is appropriate for the equipment that you're using, and I will open these up in a little bit and you'll see some differences in the set. You need to make sure if it says ultrasite or if it says infusamat, you know, which type of IV pump it goes with, and make sure it's appropriate. Some of the other equipment you'll see here, anytime that I have tubing hanging, I always need to make sure per facility policy that I label it. At most of your facilities, your tubing will expire within 72 to 96 hours. If you have a securement device on your patient, which is what I put on like whenever I did the IV start, then typically your tubing is good for 96 hours. If you do not use the securement device, it's typically only good for 72. But it also depends on whether or not you're hanging IV piggyback or antibiotics and you have intermittent infusions, because sometimes it makes your tubing only good for 24 hours. So always make sure you go back through and look at your hospital policy, but label every tubing. You'd have to label the primary tubing. You'd have to label the secondary tubing. And usually what you end up labeling with it is the date and the time that you hung it, so that they know that when Tuesday comes, I need to change it at this time because it was hung at this other time. Some of the other things you may see might be what we call red caps, and typically once you've got the tubing primed, you're certainly going to assess your IV site and flush it with a new saline flush to make sure it's patent. You're certainly going to swab it and then attach the tubing. If you have to unattach the tubing for any reason and you need to leave it hanging, you need to make sure you put the red cap on the end of the IV tubing, otherwise you can contaminate the tubing. You never want to leave it kind of hanging open to air. If you do walk in and see that, you should get new tubing. If you walk into the room and the tubing is not labeled appropriately, you have no idea when it was hung, you need to make sure that you get new tubing and start over again. Other equipment you might need, some alcohol possibly if you're going to be swabbing the site for access, saline flushes, because once you get this the tubing and the fluid and stuff primed, you're going to need to attach it to the saline lock. And then also some labels here. If you open up the IV bag and you've spiked it and you've primed it, you need to make sure you label and date, time, and initial the IV bag as well, because as we said, typically they're only good for about 24 hours, but check your hospital policy. So now that we've gone through some of the equipment and stuff here, I'm actually going to go through opening the equipment, spiking the bag, and priming and going through and using the IV pumps. So the first thing I'm going to start off with is showing you how to actually go through and spike a bag and how to prime it manually. And then we'll go through and use one of the IV pumps. So as we've already discussed, I would want to make sure and go through and look at the tubing and make sure it's clean, dry, and intact, and the expiration date is as it should be. I'd want to make sure and check the drops per milliliter for what I'm using. And then I need to go through and make sure this is the appropriate tubing for the IV pump that I'm using. And this does match because as it says Outlook, it says Outlook Safety Infusion System. One of the other ones says something else when we get to it. So what I'm going to go ahead and do, I'm going to go ahead and open up my tubing. This is not a sterile procedure, so it doesn't make, I don't have to keep it sterile. But one of the first things you always need to do as soon as you open up your tubing, you need to go ahead and clamp it. Because if I do not have it clamped and I spike my bag, then the fluid will run all through the tubing and you'll end up with a lot of air in your line and you'll have complications. So typically what I do is I go through and I go ahead and clamp it at the main clamp site. Now as I'm looking at this, I'm going to show you some pieces of the IV tubing and tell you what they're called and some of those kind of things. So at one end, you actually have the spike and it is covered. If you take this off, this must be maintained sterilely. So I usually keep the cap on it until I'm ready to actually do the spiking. This is what you call the drip chamber. And this is where you could actually watch the drops actually fall. And so you could stand here and count the drops per minute and do your math calculation to confirm and then do your milliliters per hour. All along the rest of the tubing, you're going to see some individual clamps here that you can actually use to clamp the tubing. You'll probably see some air filters in here. You're going to see some ports for access. Typically, the very first port closest to your drip chamber is typically where your IV piggyback medicines go. But you always want to confirm that that hangs above the pump. And when we get into IV piggyback, you'll see that. This set, again for the Outlook, you'll notice that it looks a little bit different. This is the actual piece that goes through the IV pump, and we're going to come back to this in a minute, and this piece goes with it. This piece can actually clamp as well, so if you end up taking it out of the pump and you're trying to free flow fluids, you'd want to make sure that this was unclamped, and that's not typically something that's done. You really want to use the IV pump to control fluids. Again, another port. The main clamp, which is where I usually go and clamp to prevent the fluids from infusing down the line. And then you've got the last port, which is the port closest to the patient. And this is typically where you end up giving your IV push meds. This piece at the end, if you take the cap off, this end must be maintained sterilely because this is the end that will attach to your saline lock so that you can administer your fluids. So I'm going to put that cap back on here for a minute. So I've gone through and I've inspected the tubing. It looks clean, dry, and intact. I've clamped it off to prevent any leakage of the fluid going back down. If you'll note, I keep a hold of my tubing. You do not want to let it fall on the floor and drag because you're going to introduce, germs and stuff to your patient. So what you might want to do is come and just lay it up here on your table. And then you're going to come, I've already confirmed, clean, dry, and intact. It is the correct fluid. There's no issue with the expiration date. And when I go to open it, typically there is a little piece at the top that allows for you to pull and for it to open and break freely. When I pull it out, I also need to make sure and inspect the bag to make sure that there's no leakage. Sometimes you'll have a little bit of condensation in the bag here, but you need to make sure that there's no leakage from the bag. When you're looking at the bag, you need to make sure most of them will have 2 ports here. You're going to have the port here with the rubber cap, which is where you can actually add things to the bag. Typically, we do not add things to the fluids. If you need additives, they need to come from the pharmacy added, if there's anything special that needed to come with it. The other one is the actual port where you're going to spike. So when you look at this, there actually is a plastic piece on the end of it, and what you're going to do is you're going to come and you lift it up and you pull and it comes off. Once you pull that off, the inside of that port needs to stay sterile. You do not need to be touching it. The next thing you're going to do is come back over here, and off your IV tubing, you're actually going to grab your spike and you're going to take the cap off of it, and remember, the spike must be maintained sterilely. This is when you're going to have to practice. Usually the way I advocate to hold it is come up here to the actual port and hold close to, but not actually contaminating the tip. And then you've got your spike, and when you come in your spike, you can actually twist it and you can actually spike the bag. Some folks will come and they will actually do what we call a football hold, and they will hold it this way and then come and spike it, making sure that you don't contaminate the port or the actual spike. Another way people may do it, they may hang the IV bag up here on the pole, and they may actually spike it that way. Please remember that once it is spiked, if you take the spike out and turn the bag upside down, your fluid will leak all over the place. So please make sure that you don't do that. Now that it is spiked, I can actually invert the bag and I can fill the drip chamber. So when you look at the drip chamber, I need to squeeze it and make sure that I fill the drip chamber to at least 1/3 to half full, depending on what your agency policy says. That way you make sure that you don't end up with air all down your line. The next thing I need to do is actually what we call priming the line. And please make sure that you're very cognizant during this process, because if I did not prime this line and I attach this to my patient now, I would end up infusing all of this air into my patient and you could cause detriment. I'm now going to come and hang this up on the actual IV pole so I can discuss priming the line with you. The reason for priming the line, as we just stated, is to get the air out of the line. So one thing you might want to have might be a trash can. I'm now going to come over here and move my trash can. If I cannot move it with my feet, since I move the trash can with my hands, I want to go ahead and make sure that I foam. Anytime you touch anything like that, you want to make sure you foam or wash your hands in between. So at this point, I've got my IV fluid hanging up here. Got the drip chamber filled to at least 1/3 to half full. I'm now ready to go ahead and prime my tubing. And the purpose of the trash can is to catch any fluid that actually leaks out as I'm doing the priming. Again, you don't want to let the tubing drag across the floor or anything like that. With this tubing, there is a special way that you must hold it to make sure that it forces the air out of the piece that goes into the actual IV pump. So with this one, you will see that this piece looks like an arrow, and you will see that there's metal down here on the bottom. So what I always say is metal down, arrow up. You must hold it this way, because if you don't, then it will allow air to collect in here in the tubing, and you won't get all the air out, and then you'll have issues with your pump reading for air in line. Also, you could introduce air to your patient, certainly. So again, metal down and arrow up. Each agency uses different pumps, potentially different tubing, so you always want to make sure that you go through and learn about the pump and the tubing. I'm going to cover 2 different pumps that you may see used in the lab today. So as I'm doing the priming, I need to make sure that this stays with the arrow up and the metal down the whole time. The next thing I'm going to want to come and do is I'm going to want to unclamp my clamp. Now please remember, gravity is what is controlled here. So the higher the bag hangs, the quicker it's going to flow. Also, if I raise my tubing up, then gravity is going to decrease. But I lower it down, it's going to run faster. So I'm going to go ahead and open it up. And as you're watching, you'll note that the drip chamber is going to fill. You'll note that it's forcing the air out of the tubing, and you can actually tap it as it goes through along the way. You'll want to keep this turned that way the whole time, and then be watching and making sure it's over the top of the trash can. And you'll want to let it force any air out of the line. If they're little teeny air bubbles, those are not as big of a worry, but it's good to get out as much air as you can. The thing you want to remember, though, is I don't want to be really wasteful and waste a great deal of the bag out of here, because it's going to change, certainly how much fluid your patient potentially gets here, but also, how quickly you have to change a bag. Another thing you have to worry about is if this fluid has additives and things in it, then it's certainly going to be a little bit more expensive than just normal saline just by itself. So as I go through, I have primed it, and I actually saw normal saline come out the end down here. I'm going to take a look down through here and make sure that it forced the air out of the line. Taking a look all the way down, and you can tell that there is saline down through this whole line. So at this point now, I have actually inspected the tubing, I've inspected the fluid, I spiked the bag, I filled the drip chamber, and then I filled the line or primed the tubing. That is one way of manually priming the tubing, but making sure the air is out completely. The next thing I'm going to do is bring you over here to the IV pump and talk to you about the function of this IV pump individually. Okay, so again, whenever I pulled the tubing out, I made sure that it matched the IV pump that I'm using. So, this is actually Braun pump tubing, and it is for the Outlook Safety Infusion System, and this is the Outlook Safety Infusion System. Now, when you look at this, you'll have different levels of this, and this is one of the older pumps. It's an Outlook 100. Most of your systems are up to at least a 200 or more by now, but again, every agency may have different pumps. It just kind of varies, so you need to make sure that you learn what pump you're using at your facility. As you look at this pump, let's look at some of the features. Certainly, you've got the power button here, so this is how you're going to turn it on. And I want to remind you at this point that your pump should come with a plug-in, and they should be plugged in, because these pumps will run off of batteries, but you want to make sure they're always plugged in, because if your patient has to go somewhere, let's say for x-ray or CAT scan or something like that, then the pump will be functioning off the battery, and you want it fully charged because your patient could be gone off the floor at length. And if it doesn't have a charge on it, then your patient might not get the fluid, it might not infuse, and it might be really important for them to have that fluid at that time. Obviously it is, it wouldn't be ordered. Some of the other features that are here, the next one beside it that you'll see highlighted is AC, and there's a little green light beside of it. And basically what this means is when you have the pump plugged in, this will show here. The other one you'll see here would be lit if it is functioning off of the battery, and that would be if the pump is unplugged and you could see that it was rolling off of that. You'll notice here that the hold button is highlighted, and that is because the pump is on hold currently. If the pump was actively running, and what I'll do is make this so it will run right now. I'm going to hit primary run here. Another button that you might see would be the alarm button, and that would possibly be if there was high pressure on the pump, which could come from your patient having their arm bent. It could come from the tubing being clamped off. Some other alarms, if the set is not in the pump and loaded appropriately. Sometimes it can alarm if the battery is, having some issues. And as you'll notice here, the occlusion warning has come on, and the pump is now alarming. And eventually it'll get to the point where the alarm button, would read orange once it's reached the point that it's no longer going to infuse, and you would see that come on at this point. So at this point we would have to address the occlusion warning and put the pump on hold. And you notice the hold button comes back on. And the reason the alarm button came on for occlusion was because the tubing was clamped. And you see the alarm button has now come on. So the next thing I need to do is come and then hit the hold button again. And once I've addressed the warning and fixed the occlusion, then I could come back and then run the pump and do what I needed to do. So just in summary, the AC light is lit whenever your pump is plugged in. The battery would be lit if your pump is functioning off the battery. Hold is lit if your pump is on hold. There would be the green light running when the pump is actually running, and then the alarm light would come on when occlusion warning comes on, or some of those issues. So just look for what's lit up across here and it'll kind of tell you. These two screens here are going to show you the rate in milliliters per hour on this side for both the primary and for piggyback or secondary, and then the volume to be delivered, or you might see it as VTBI or volume to be infused, depending on the pump. This one here all the way across is for your primary. This one here all the way across is for your piggyback or your secondary. You may hear it turn. So rate in milliliters per hour, volume to be delivered, or volume to be infused. These buttons here, you have your primary run, you have your piggyback or secondary run. And then these buttons down here actually control the rate or milliliters per hour on this side, and then the volume to be delivered on this side. So if you look at it, this is the tenths place because the red mark is considered to be a decimal. This would be the ones, this would be the tens, and this would be the hundreds, because typically you're not going to run milliliters per hour on this particular pump more than 999 milliliters per hour. Over here, this is the volume to be delivered. Again, the tenths place because you've got your decimal. Here's the ones, the tens, the hundreds, and the thousands, because you could actually put 1,000 here on the pump. The hold button, if you need to pause it for any reason, the menu, and we will come back to this. The cursor can move things around, and then the enter button. So at this point, I'm going to go ahead and run the tubing through the pump, but a couple of other things I want to show you. Whenever this is attached to the pole, it is attached by this piece here. And so basically you can come and pull this out and push down on it, and it will take the pump off of the pole. Thus, it is now mobile and I can move it with the patient. To get it back on the pole, I come and I pull back up on it tightly and then push that forward. Please be careful with these pumps. They are very heavy, and if you don't get them secured properly, they could fall. Another feature to show you on the back of the pump is the actual lockout button. There is a small little button here on the back of the pump that once you get it set and it's infusing, once you push this button, you've now locked the pump so nobody can come and manipulate the buttons on the front. And in order for it to be taken off, you have to come and re-push the lockout button. If you were going to plug in another pump to this pump, you could actually pull this slide down and you could put the plug into this one, and then this one's plugged into the wall, so therefore they're both plugged in and charging. When it's not in use, I recommend keeping that closed. Another feature on the back of the Bronze Safety Infusion System, you'll see is there's a little piece here for actually where your cord can go. So when I come and unplug this, then what I can do is I can ramp the cord up, and I can actually secure the cord here to the back of the pump, so that the cord is secured and it's not dragging the floor or any of that kind of stuff. So when my patient gets ready to go, for instance, to x-ray or CAT scan or some of those places, whenever they come back from wherever they went for the procedure, you can actually unhook this, plug your cord back up into the wall, and then re-secure this so it doesn't catch on anything. It's just a little safety feature for the cord, so the cord is secured. So in order to open the pump, you actually pull the green bar forward, and then the whole face comes down. Now we are to the point where we can actually load the tubing through the pump. This particular pump and tubing load from left to right. So when you're looking at this, the metal actually fits to this magnet that's in here. So you want to make sure that the metal is turned towards the magnet. There are also little holes all along the right way that need to fit on these little hooks. So as you go through and look at it, the metal will automatically stick to the magnet, and then you'll see the little pieces stick through the little holes. When I come over here to this piece, I usually push on the white on both sides, and what that does is it actually clamps this in, and this is now ending up clamped inside the pump. You also need to come through and thread these through on both sides to make sure they don't get clamped. So again, metal to metal, so the metal is stuck on the magnet. Make sure the holes fit all the way through. Push on the white until it clamps, and then make sure both of these sides are in here so that they don't get clamped. And there's some instructions in here that kind of go through this with you. When you're ready to close it, you need to pull this back up, but you must pull the green back out towards you before you close it, and then you need to push it back together. Now your actual extension set is loaded through the pump. I'm now going to turn it on. And typically what I do is I make sure I get everything set up here before I go back over to my patient and actually get it hooked up. So once it turns on here, we'll go through the other features of the IV pump. So we've now turned it on, and once it comes up, you'll see over here there is a window that correlates with the menu button, so you can kind of see what's going on. But then you've also got writing over here in the primary for the rate and the volume to be delivered. We're now on the hold button, so I need to come back over, and I want to set my primary, so I'm going to hit the primary, and you see it comes up in this line across. So I need to go back and correlate with what my doctor's order was. So let's say the doctor ordered 100 milliliters an hour. So I need to come over here to the hundreds, and I tab up to 100. If it was 125, then I would come over and I would correlate with the ones, the tens, and the hundreds. For the volume to be delivered, it depends on if there is a certain amount of volume that the doctor's ordered or if it's a continuous infusion. I know that I only have a total of 500 in this IV bag up here, so I don't want to put that total amount in here for the volume to be delivered because I could end up with air in my line. So what I'm going to do instead, I usually go with about 100 less than what's in the bag. So if there's 500 in there, I'm going to put 400 on here. And that way, once this volume of 400 has infused, the pump will alarm and it will remind me to come in and check on it and put a new bag up or whatever it is. If the doctor had ordered a certain amount, then I would put that amount here. If I had a piggyback to infuse at this point, I could come down and I could go to the piggyback and I would put in the rate for the piggyback and the volume to be delivered. When the volume is done for the piggyback, it will automatically flip back over to the primary infusion here on this pump. Now, some of your pumps, they ask you questions that prompt you to see if that's really what you want. I'm going to come over here to this window, and it will give you a quick reading of the total volume infused, and then it also speaks to the occlusion limit. Basically, if your patient has bent their arm, there's going to be a pressure buildup in here, and so it'll read occlusion. Or if I forgot to unclamp the tubing whenever I'm trying to infuse it, it would read occlusion. So if you start seeing these alarms, you're going to have to troubleshoot the machine to figure out, oh, my patient has their arm bent. Oh, I forgot to unclamp it. I forgot to unclamp the saline lock. Whatever it is that's going on, and you have to kind of troubleshoot the issues that you're having. We discussed how to troubleshoot alarms and those kind of things if you're having issues with your patient. So what I'm going to do at this point, if I'm ready to start and everything, I've got the tubing primed and all this, I would have gone up, I would have assessed my IV, I would have flushed it to make sure it was patent, make sure there's no issues. Certainly every time I flush a saline lock, I need a fresh flush. I have to swab it in between every time unless it's got a swab cap on it. The end of your tubing should always be kept sterile. So when I'm to the point that I want to take this off and attach it, it basically sticks in and screws to the right, and this would attach to the saline lock. And of course I would have to keep the end sterile. So if this is attached to my patient here now, then I would be ready to hit the primary run button. As I'm doing that, then you should come through here and see the run continue. And what I'm watching for is the run button to continue through here. And you may have an alarm, and I'm going to show you what it looks like and sounds like if the alarm goes off. As you'll see, I have not unclamped my tubing, and I'm going to let this go ahead and run for a minute, and we're going to let you see and kind of hear what an alarm sounds like, because since the tubing is clamped, it should alarm for an occlusion here in just a minute. And we'll see if it does. And it did. So if you're looking at this, you'll hear it kind of ding and alarm, and it is reading occlusion. So what I need to do is come and hit the hold button. And now I need to go through and troubleshoot based on what the alarm was. And since it read occlusion, I always start first at the patient and assess the patient's saline lock, make sure that it's not clamped and that the patient's arm is not bent. And then I work my way back up at the tubing. And obviously you saw that I did have it clamped, so I'm going to come and unclamp it. And then I would hit the primary run button again. And hopefully everything will run, and you'll watch the drip chamber and make sure that it's infusing. At this point, I'm going to show you how to stop it and clear the total infused on the pump. So in order to clear the total infused, you have to come and hit the hold button first. And now you see that it's indicated that it's on hold here. You come over here and you look at your actual screen to see what it says. And you need to make sure you look at the total infused before you start, because you're going to need to account for this in your intake and output. Some agencies do the intake and output, the intake off of IV fluids when you start the bag through the medication administration record and the computer charting, and when you end the bag and it automatically inputs it. But you may occasionally have to come and clear the pump, and if you do, I'm going to show you how to do that. So what you'll need to do is, you've noted the total infused. I'm going to hit the menu button, and you're going to see it says dose scan, clear drug name, clear total infused, and then it's got your occlusion limit. You're going to move your cursor down until clear total infused is highlighted and hit the enter button. And it's going to tell you the present total amount infused of whatever the amount is will be zeroed. Is this okay? The yes is highlighted, so once you hit the enter, it's going to clear the volume. You need to make sure that you've made note of it before you hit the enter button. Now that I hit enter, the total infused now is back to 0, and you have thus cleared your pump. There are some pumps that whenever you turn them off, the volume goes away. There are some pumps that saves the volume and it will still be in there, and you'll have to clear the pump before you use it. Please make sure you're aware of what pump you have and what needs to happen with that pump. Also, if you're supposed to be clearing the pumps in between uses, and putting in the intake in the computer, or if whenever you change the bag and you put that in the computer, if the volume automatically goes in. At this point, I'm done with the Braun Outlook pump, and so what I'm going to do is go ahead and turn the power off. If you leave it in the hold mode for too long, it will alarm to make you come and do something with it. Now at this point, if I had taken this loose from the patient and I did not have this cap, this would be when you would have one of the red caps available. Now that you've taken the red cap out of the package, you'll notice that it has two different ends. You want to make sure that you keep this end sterile as well as the end of your primary tubing. And the purpose of the actual red cap here is to come on the end of the primary tubing and secure. And what it actually does is it keeps the primary tubing end from being contaminated. You never want to take the end of the primary tubing and put it back into any of these ports. Number one, because it causes a pressure buildup and it can potentially cause air bubbles. The other thing is because this is not as clean. You always want to keep the end sterile, and there are potentially germs in here which could cause issues with this. So always, if you're going to stop IV therapy and this end is going to be unsecured from the IV, it's always best to use a red cap here to secure it. Once you've put the red cap on, then what you could do is come and hang your tubing up on the pole on the pump. And so we'll come and we'll hang it up here. And once you have it up here on the pump, always just make sure, as we've already stated before, that you have your tubing labeled, your bag would be labeled with the date, time, and initials, and your patient's information, and now the end of your tubing is sterile. Okay, so the next pump that I'm going to show you about is the Braun Infusamat pump. And so as you're going, as we discussed before, you need to make sure you got the appropriate equipment first. You need to make sure you look at what the doctor has ordered for the fluid. The doctor has ordered normal saline, so again, is it in a bag? Is it clean, dry, and intact? Is the expiration date here? And then make sure you have the tubing that actually matches. And this is the Infusamat Space Pump IV set. And then if you look at the pump, it is an Infusamat Space Pump. So you always want to confirm that the tubing you have matches the pump that you have. Look and make sure that it is the appropriate drip rate, that it is the appropriate tubing, that it's within the expiration date, and that the packaging is clean, dry, and intact. So the next thing I'm going to do, I'm going to go ahead and open up the tubing. And if you'll remember, like I said in other parts of the video, as soon as you open up the tubing, you need to make sure that you clamp it off. The reason for this is so that when you spike the bag, you don't end up with a bunch of air all down through your tubing. Now this tubing is a little bit different than the tubing I showed you in the previous portion here. Some of things are the same. So for instance, if you're looking at this, you've still got the spike, which needs to stay covered so it stays sterile. You've still got the drip chamber, which is the same. As you're looking at the tubing, you've still got some of the clamps here that you could clamp the tubing. You've still got a air filter here, so it'll filter out air bubbles. You've still got the ports, and again, this port would be the one that goes above the pump, so it's most likely where you would hook up your IV piggyback. But as you come down through here, you're going to notice in this set that it is a lot smaller than the Braun Outlook. And it also loads a little bit differently, and I'm going to go through that with you in just a minute. As you continue on down, yet again, you've got more air filters and you've got more ports. Again, the main clamp where I clamped it off as soon as I opened it up. And then here is the port that's closest to the patient, and this would be the port that you primarily give your IV push medicines through. Again, here at the end, you're going to notice that this is a little bit different. There is a cap at the end, and if you took the cap off, you would need to make sure that you kept this tip sterile. So I'm going to put the cap back on it. But if you look at this, I'm going to actually take this off, and this is a safety piece that comes on the specialty tubing for the Infusamat Space Pump. What this does is it prevents free flow of fluids whenever the tubing is not through a pump. So you really should always leave this on here, because as you're administering fluids, you really should be using an IV pump. But if in an emergency situation you didn't have an IV pump and you needed to free flow fluids and you wanted to give a free bolus, this would need to come off, because this does not allow for that. So in your usage, you guys should maintain this port down here at the end. But I want to go through and make sure and show you the difference in the tubing. So we've gone through the differences in the tubing. I'm now going to lay this up here. Make sure you don't let it fall on the floor or any of that kind of stuff. I'm going to go ahead and open up my bag. And again, After I open it, I need to make sure that I've assessed it. It's clean, dry, and intact. You know, there could have been a little bit of condensation, but I want to make sure it's not leaking. Again, you've got 2 ports here. This is the port that you could add things to, but traditionally we don't add. The pharmacy should be adding additives and things to it. And this is the port that you actually spike. Please remember, once I get done with these, I should come and I should label the IV bag with date, time, initials when I hung it, and then I'm going to have to label my tubing with the same type of thing. So once I'm ready to spike it, you just pull the end here and you're going to pull straight off. You need to make sure that you don't contaminate the inside of this port. I'm now going to come back over here and take the cap off of my spike and keep it sterile. And again, this is the way I like to hold mine, but you can actually do the football hold or you can hang it up, whatever you feel comfortable with. Whenever I come in and do this, I'm now going to come up here, and as I'm spiking, you just notice I'm twisting. Make sure I don't fall in the trash can here. And now that I've spiked it, I'm going to revert my bag and fill my drip chamber to 1/3 to half full. Now that I'm to this point, I can come and I can hang my bag up here on my pole. And I'm now to the point to where I'm going to prime this tubing through the pump. I would highly recommend, if you're going to use the Infusimat space pump, that you prime this tubing through the pump, and I'm going to show you how to do that. With the other pump, the Outlook, typically we end up priming it outside of the pump because that pump doesn't allow for that feature. I advocate for priming it through this pump because it forces out all the air and you have less issues. Before I get to that point, I'm going to talk to you about some features with the pump. This one is similar in some ways and different in others. If you'll notice here at the back, there is a plug feature here for the actual charger. You do need to keep these things plugged in so they will stay charged exactly like the other pump, because if they are unplugged and the battery is functioning, if they need to go off the floor for an extended period of time, the battery might go dead. These also are secured in a little bit of a different manner. You do have a clamp back here that will secure it up to the pump. In order to get this actual pump off of the pole, there are 2 different safety features up here. And there's a little press lever you need to press in on, and you need to press down on the top, and then the pump will slide out. And you can actually take it off, and it's portable, and it weighs a whole lot less than the other, and it can go with the patient. To put it back in, it simply goes back in along the slats, and then it's locked back in there, and you'll hear it kind of snap. Several different buttons that you'll need here. This button here is the on button. This button here is the open door button. So the first thing I'm going to do is actually open the door here. And then it says open door. And if you hit the up arrow, that is for yes. The down arrow is for no. So I want the door to open. I'm going to hit the up arrow, and it's going to open up here. Now if you look at this one loads backwards from the other pump. So when you're looking at this one loads from right to left. If you'll look at this, you'll notice that this looks like a sideways D. You always want it where the D is on the bottom. And it's going to come and it's going to fit in this slat here. And the D is on the bottom. Then you come and there's this latch that pushes in here. Then you also come, and if this is up, you need to push this down to start with. You've got the green piece that slides in the slat here, and you need to push it in until the green comes back up. And then you need to make sure they're clear through both sides. So the D is on the bottom. You've got the white piece that snaps over the little piece here, and then the green piece goes in until this piece pops back up. You make sure that these are through here so they're not going to get occluded, and then you simply close the door, and it's a little firm. Make sure you don't get your fingers stuck in here anywhere because it'll pinch. And then it's going to kind of walk you through it. So if you look at it, it says original space line. Yes, that is what I want to deal with, and there's an over arrow, so I want to hit that. It tells you infusion line change active, keep the roller clamp closed. And it is. And then it says infusion line change active, open roller clamp. So basically, as we went through and we were talking about it, it said to keep the roller clamp closed at one point and then to open it up and just follow the directions on it, and you would open the roller clamp as applicable. Now we're to the point to where it says prime the line. So it's priming the line with 22 milliliters. If you want it to do that, you hit the up arrow. If you don't, you hit the no arrow. I do want it to do that because my line is not primed. There's air currently in the line, and that's not acceptable. So I'm going to hit the yes arrow. And as it goes through, you'll watch the bag is actively dripping, and it's forcing the fluid down through the tubing. And so it's going to prime the line. It does usually take about 22 milliliters to prime this line for the Infusamat space. Please always make sure that you remember that it does take a certain amount of fluid to prime a primary line. Thus, if you had a piggyback up there and infusing, you would make sure that you need to infuse a certain amount of fluid to get all of your medicine out through the line so that they don't end up losing part of their dosage. And we'll talk more about that whenever you do piggyback or secondary medications. You can actively see the fluid coming down the tube, and here it comes right here towards me. And it's forcing the air out, so I'm going to hold it over my trash can, which I should have here. It may or may not take the full 22 milliliters, but as it's doing this, you want to make sure that there aren't any air bubbles or anything still in it. So it probably would be a good thing to go ahead and do the full 22 milliliters. Now, once that is infused, it's going to come back and ask you, do I want to prime the line again? I don't want to prime it again. I've looked at it. There are no air bubbles. And actually, this one has one. So if you look at it, I'm going to hit it again and see the air bubble moving down the tube. And so the air bubble is being forced out, and we'll let it keep priming, and then I'll stop it before it's time so you guys can see how to stop it if it doesn't end up doing the full 22 milliliters. And you can see the air bubble following down right here, and it's forcing it out of the tubing. And then it actually caught in the air vent. So I'm ready to stop it, and you see it says OK to stop prime. So I'm going to hit OK. Now that it's finished, it's going to flip you over here to some other screens. So I'm going to set that there to keep it from going in the trash can. The next piece then is using the drug library. So if you look at it, if you want to use the drug library, you can hit the yes. If you don't, you can hit the no. I'm going to go with the yes so I can show you some features on this pump. This one has med surge on it, and it also has critical care. There are certain medications that you commonly use on the floor that will be loaded in here, and you can use this to go back through, and it'll help you with infusion times and also concentration and drug strengths. So if you want the med surge, it has a left arrow, so you would hit that, and then you've got ABC. Those are highlighted, so what is under the ABC would be anything that fell into that. So if it was alphabetically an ABC that you were looking for, then you could simply tab down until you found what you wanted. So for instance, if you were going to give an infusion of aminophylline, and if that's what you wanted, you would hit the overbar. If that's not what you want, and let's say alphabetically it doesn't fall with the ABC, then what you're going to want to hit is the right arrow, and it will now take you to DEF. If alphabetically it's not there, hit the right arrow again, it takes you to GHI. Again, if it's not there, move on over and it's JKL. And so if it falls alphabetically there, tab down and you can find the medication that you want. If you ever end up in an area that you don't want to be, then what you want to do is go to the C button, and that will take you back to the previous screen. So let's say I'm done in here and I couldn't find what I wanted and I hit the C button. It took me back to the screen with med surge and critical care. So let's say instead I wanted to be in the critical care medications. I would then tab down to the critical care and do the over arrow, and it would bring up critical care, and it works exactly the same way. If it's ABC, alphabetically tab down. If it's not, tab over. I'm now into DEF. If it's not in those, tab over. We're now to GHI. So let's say I wanted heparin. I'm going to hit down, and if I want heparin, it says hit the over arrow. That would then take me into the heparin screen to where I would need to put in the dose, the concentration, strength, and the rate. If I end up getting somewhere that I don't want to be, hit the C button. It asks you to use the last therapy. I don't want the heparin, so I'm going to hit the no button, which takes me out of it. And then I'm back to the drug library. So let's say you didn't want to use that to start with. If I don't, the no arrow is down, and it takes you over to the volume to be infused. And basically the way you use to put this in, you use the arrows here. It's similar to the other pump, but you have tens and hundreds with your decimal. You've also got the ones place, the tens place, the hundreds place, and the thousands place. So let's say for my volume to be infused, I actually wanted 900. So I tab over to the hundreds, and then I go up to 900, and then I'm going to hit OK. It's then going to take me to the rate. I have to hit the over arrow to get the rate screen to come up, and then I'll put in the rate that the doctor has ordered. So let's say they put in 125, and I ended up going to the 1s and going up to 5, going to the 10s and going up to the 2, and the 100s and going up to 1. I now need to look back through this and confirm. I'm going to give it at a rate of 125 milliliters per hour. If that's truly what I want, then I need to hit the OK. If you need to go back and change anything, all you have to do is highlight the screen that you want, and then you go through and make the changes. If I was ready for this to start infusing, then I would actually come over here and I would hit the start button. Once I hit the start button, there's a few things on this screen that you'll notice. If it's actively running, you will see arrows click all along the way. This over here shows you how full the battery is, and if you can see, the battery is completely full. It also shows you a plug here, which means that the machine is plugged in and it's charging. This screen right here across the top is showing you the pressure, because if it gets beyond a certain pressure, then it's going to alarm with an occlusion limit. And sometimes if your patient bends their arm, or let's say you come back and your tubing gets crimped, then that could be there, and that just kind of shows you kind of where we're going. Also, if you start having trouble flushing your IV, that could be a problem. It also comes through here, and the volume will tell you how much volume has infused. The time tells you how long it's going to take to infuse that full 900 milliliters that you put in at a rate of 125 milliliters per hour, and the volume to be infused is telling you how much volume you have left. Let's say now I wanted to come and put a piggyback in the pump. I'm now going to have to hit the stop button, and I need to now put the piggyback in this pump for the rate and the volume to be infused. In order to do that, I need to move up or down. So what I'm going to do is come up here with the up arrow, and the next button you're going to see is status. You're also going to see options, and then you're going to see special functions. Your piggyback or secondary is under the special functions. So to get to it, I need to hit the left over button. You'll see dose rate calculation, drug library, or piggyback mode. I need to tab down to piggyback mode, and since it says a left arrow, I need to hit the left arrow. This is very important. It's going to ask you if you want it to automatically change. I'm going to hit the yes button. What that means is once your piggyback or secondary is done infusing, it will automatically kick back over to your primary rate, and that is usually what you want. Do I want to use the drug library? At this point, I'm not going to, so I'm going to hit no. I'm not going to use the dose rate calculation, so I'm going to hit no. And again, we're back to the volume to be infused and the rate. So I'm going to say that the volume for this is 50 milliliters, and that'll be determined by, how much you mix the medicine with and what your concentration strength is. The infusion rate has to do with how fast you can run it, and all of this stuff we'll cover when we get into piggyback meds at a later point. I'm now giving 50 milliliters for the piggyback. I'm going to hit OK to confirm it. And now I need to put my rate in. So when I do this, it's whatever the predetermined rate is. I'm going to put it at 100 milliliters per hour. If I infuse 50 milliliters at a rate of 100 milliliters per hour, it's going to infuse in 30 minutes. And we'll show you how to do that math at a later point. I'm confirmed that this is good, and it does tell me it's going to take 30 minutes for that to infuse. So it's just confirming it. Hit OK. Now I'm here to the screen that shows me I am in the piggyback mode, and you can see that because it's highlighted. There is something up here that would allow me to tab up and change to primary, but I don't want to do that. I want the piggyback to infuse. If that is true, then I would come through here and I would hit OK or start. And I actually want this to start, so we're going to do that. And then what it will do is it will now, you'll see the buttons infusing, and piggyback will be highlighted. I'm going to hit stop. If I wanted to move back to the primary, I would have to tab up. And you can either hit the over button or you can hit OK. And now you'll notice that the primary is highlighted. So what you need to notice is what is highlighted up here at the top, because that will tell you which one is infusing, the piggyback or the primary. Now at this point, I don't have a piggyback hanging up here, and I'll show you how to attach the piggyback and how you can go through all of that stuff at a later point. The purpose of this video is to show you the use of the pump. So please just make sure that you know if the primary is infusing, it will be highlighted. Versus if I had the piggyback highlighted, then it would be infusing at the rate I had set for that. At this point, let's say we're finished with the infusion and we actually want to put the pump on standby. Normally what you would do is you would hold the start button down for 3 seconds and it would put the pump in standby and it doesn't actively turn off. If I hold the off button, and there it goes, see the standby. And it says go to standby in 3 seconds. At this point, all of your settings are saved in the pump, including your infusion rates and all of that kind of stuff. If I want to cancel the standby, you'll see it says hit the C. So I went back into it and I canceled it. And sometimes you use the standby button if it's alarming and you need a little bit of time to work on what's going on. Or maybe you've got intermittent infusions and you need to pause the pump and you don't need it alarming and then you want to come back and have the same rate saved. So I'm actually going to put it back in standby again. And then it just saves your settings and all that kind of stuff. So at this point, we've gone through how to use the Infusomat space pump and how to prime through the pump, which is what I recommend. You can prime this tubing without going through the pump if that's what you would like to do. Like I said, I don't recommend it, but if you're going to prime it without going through the pump, you're going to have to remove the safety piece at the end because it won't allow for free flow unless you take it off. And then you'll have to put it back on and make sure that it is primed. That's pretty much everything you'd need to know with the Infusomat space pump at this point, and I'll come back and speak to piggybacks and how to hang them and where they go and how to give IV pushes at a later date. Thank you very much.